In this video, we're going to cover the best core exercises that you can do to help you resolve your back pain. But before we get into the exercises themselves, we first need to cover a little bit of the function and anatomy of the core muscles, as well as a couple of myths surrounding back pain and core strength or stability. The main core muscles that we're going to be focusing on in this video are the rectus abdominis, which is often called the six-pack muscles, the internal and external obliques on the side of your trunk, and the lumbar paraspinals or extensors, however you want to call them. These core muscles can all either resist motion or produce motion. The rectus abdominis mainly either resists extension, which is bending backwards, or produces spine flexion. The internal and external obliques either resist rotation and side bending or produce rotation and side bending. And the paraspinals mainly resist flexion, which is bending forward, or produce extension. They do have a small impact on side bending as well when working one at a time, but their main functions are in either flexion or extension. Now, there are other deeper core muscles such as the transverse abdominis, the multifidi, the quadratus lumborum, and others, but we're not going to cover these as much in this video, as a lot of them have overlapping functions with the muscles that we're going to be talking about in this video. So when we discuss the rectus abdominis, we're either going to be discussing exercises that resist extension or produce flexion. When we're discussing the internal and external obliques, we're going to be talking about exercises that either produce or resist rotation and side bending. And when we talk about the paraspinals, we're going to be discussing exercises that either resist flexion or produce extension. One of the main myths when it comes to back pain, especially for people who are lifters, is that core weakness or a lack of stability is the primary cause of back pain. And we know that this just simply isn't true. While core muscle performance can absolutely be a variable or a factor in somebody's pain or injury, it is only a very small piece of the puzzle. Back pain and back injuries and all other instances of pain and injuries are very complex and multifactorial, meaning that there are many different variables that influence whether or not somebody's going to get injured or have pain. These do include things like muscle strength and endurance and power, but they also include things such as sleep, nutrition status, life stress, and so many other sociocultural factors as well. The second big myth surrounding back pain and core muscle performance is that specific core exercises are really the key to solving back pain. And through many different studies and pieces of research, we just, again, know that this isn't necessarily the case. Core exercises can certainly help back pain and help somebody recover from an injury and get back to training, but they don't appear to be any better than other forms of exercise in helping to resolve back pain. Now, that doesn't mean that core exercises should not be a part of somebody's rehab plan when coming back from back pain. And it also doesn't mean that core exercises can't be very useful when dealing with back pain. All it means is that the utilization of core exercises is only, again, one piece of the puzzle, and other factors need to be considered, such as training load management, stress management, sleep, nutrition, and other factors as well. Direct core exercises can have two really big benefits for somebody who's dealing with back pain or trying to get back from an injury. Those are that they can, one, improve the local capacity of the tissues in the area of the lower back, and two, they can really improve somebody's confidence in their backs as well. Most lifting-related injuries are an issue to do with capacity and load. Capacity is basically how much stress your body can handle at a given point in time, and is dictated by your chronic training history, your sleep and nutrition status, life stressors, and many other things, just as pain is. Your training load is basically the frequency, volume, and intensity with which you're training. Injuries and pain tend to happen when the training load, or the stress that you're placing on your body, is greater than the capacity that your body has to handle that stress. So if the load is too high and the capacity is too low, you can get injured. And one way to build up that capacity is to do direct core training. The other part has to do with confidence in the lower back. Implementing direct core training and progressively loading it and making it harder over time is a great way to improve your confidence in your back, which is a huge part of recovering from an injury. Now that we covered that, we're actually going to talk about the direct exercises themselves. There's two main categories of direct core training. We have isometric core exercises and dynamic core exercises. Isometric core exercises are the typical core exercises that a lot of people think of, in which you're actually not moving the spine and you're simply resisting motion and load, such as with planks, side plank variations, dead bugs, and bird dogs. On the other hand, dynamic core exercises are those that you're actively moving the spine against resistance or against load. Things like crunches, side bends, rotation drills, and Jefferson curls are all examples of dynamic core exercises. In most cases, for somebody who's dealing with back pain, starting with isometric core exercises where you're resisting load or resisting motion is the better way to go because they're typically handled better by the back and they don't usually bring on pain like dynamic core exercises can. That being said, it is a good idea to progress to dynamic core exercises over time because one, your daily activities take you outside of a neutral spine position in which you're going to have to be lifting and moving objects in awkward positions and in different levels of flexion and extension and rotation and these other motions. And two, even if you can't see it with your eyes when you're squatting, deadlifting, doing clean snatches, whatever motions you want to be doing in the gym, your spine is actually moving through quite a large range of motion. And the best way to build up the capacity to handle that sort of stress is to progress into dynamic core training over time as your symptoms resolve. To make this a little bit easier to understand, we're going to break this down into 4 different categories. Those are flexion, extension, rotation, and side bending. And we're going to discuss isometric variations for each and dynamic variations for each. First, we have flexion, which in an isometric sense is anti-extension or resisting bending the spine backwards. Options for isometric exercises in this category include things like dead bugs and planks. Options for dynamic exercises in this category include things like cable crunches, GHD crunches, machine crunches, and other crunch variations. The next category is extension, or in an isometric sense, anti-flexion. Options for isometric exercises in this category include things like bird dogs, Sorensen holds, and reverse planks. Options for dynamic exercises in this category include things like GHD back extensions and Jefferson curls. The next category is side bending. Options for isometric exercises in this category include things like side plank variations, suitcase hold variations, and unilateral marching variations. Options for dynamic exercises in this category include things like 45-degree or GHD side bends, and standing side bends as well. And the last category is rotation. Options for isometric exercises in this category include things like standing palette hold variations, as well as GHD palette hold variations. And dynamic options for this category are things like half kneeling cable or band rotations, and GHD side plank rotations. The general progression that I use with my own clients is to start with isometric exercises that are of lower intensity and longer duration holds, and progressing them to higher intensity through external loading for shorter duration holds over time, making sure to keep pain about a 3 to 4 out of 10 at most. Once we're able to do this, then we'll start moving into actual dynamic exercises. I'll generally pick an exercise option from each of those categories and have my clients perform them for 2 to 3 lower intensity sets of 10 to 15 reps. Again, keeping pain to a 3 or 4 out of 10 at most. As the pain subsides over time, we can then progress to higher intensity sets of lower reps, such as 6 to 8 reps. Overall, there are no specific core exercises that you need to do to solve your back pain, but implementing smart core training can absolutely be a great way to help you overcome the pain and get back ready to train in the gym. Making sure to train each of these movement categories with sufficient volume and intensity that match your symptoms over time is really what will help you develop the capacity and the confidence in your back to get back to the things like squats, deadlifts, cleans, and all the other movements that you want to get back to doing. If you found this video to be helpful, please give this video a like and subscribe to our channel to learn how to solve your own injuries and hit the training that you want to in the gym again.